Goodness really kind of changed the script on healthcare. It's really is about being proactive instead of reactive and really changing people's lives. Hi, I'm Kaylin Felder. I'm a nurse practitioner with Goodness Health Group. I've been with Goodness Health for almost 3.5 years now. Patients will come to you when they're in the middle of a transition, whether it's right out of the hospital or just a gap in care. In those visits, we really get to address the acute issues the patient has and their needs that they're bringing to you and chip away at it. We get to slow down that pace, address one problem at a time, really feel like the patient's being heard, understands, and then be able to track that progress week after week. So I have several patient stories to back that up, and just that ability to let the patient be involved in their care, be part of that plan, that partnership with them, educating them about their health and helping to change their lifestyle for the better, and then seeing that impact and how it's not just giving relief with an antibiotic or, suturing a cut. It's actually really changing their lives. So I first met Russ a year ago, almost to the day. He had been in the ICU for a period of time. He had a lot of very complex problems. He came to me and I saw him for the first time when he was maybe 1 or 2 days out of the hospital. And he was so scared. He told me later he'd never been to a provider in years before this. He was on oxygen, very barely mobile with a walker, and just really overwhelmed. He was on a slew of all of these new medications, so it was just really alarming. Even at one point, put all of his specialists on a list with their phone number and when the next appointment was, just to help try to ease whatever burden, because it's just so overwhelming for patients. Their life has just been turned upside down. They're scared, they don't feel great, and they just don't know where to go. So I was there supporting him along the way, helping keep things straight of who we need to see, placing referrals of specialists that he hadn't been connected with yet, and then just talking about the medications he's on and really just trying to give him a better understanding of where things were. And in the midst of all that, he was only home for a few weeks, and then he had this crazy flare-up of multiple joint pain throughout his body. And come to find out, he got 2 new diagnoses with rheumatoid arthritis and gout. So he had so much complexity to him. And he doesn't even remember a lot of that hospital stay, but he just knew, I don't want to go back into the hospital ever again, and I'm going to change my life. We met so frequently, and able to get him connected and manage his progress. And he stopped drinking alcohol, stopped smoking right off the bat. He was so eager and engaged, and I really appreciated the support. Fast forward to many months now of all this continued progress and just chipping away at things. He had expressed to me, my goal, Kaylin, is I want to get back to golfing and bowling, 2 of his great hobbies. And he's just a guy who can't sit still. So he was a go-getter. He was all about changing his lifestyle, doing whatever providers told him, and he quickly got off the oxygen and the walker. Yeah, so he's back to his hobbies. He's so active. He's walking. He's got some weights. He's lifting some light weights. And one of the other things he had suffered with was really bad neuropathy. We got that under control and got him in with physical therapy to even more isolate some foot and ankle issues he was having that was exacerbating it and making it really hard to be active. He's really leaned into the support I've been trying to give him and all of his providers, and we've been able to reduce his med list down to a small amount just because of the lifestyle changes he's made.
No, it's been good working with you. It really has. I mean, like I said, I was scared when I first got out of the hospital, and I was staying with Deborah. I couldn't walk. I was having trouble breathing. You've helped me with all kinds of different things and medical advice, for sure. You helping me through with this progress that I've, with all my medical needs. It's just been fun. What was it? Last week was the first time I went to a driving range. I didn't even know if I could. I swung a golf club in the backyard, but I didn't know if I could actually hit a golf ball, kind of swing hard. And surprised myself, I guess. So I'm on my way. I can't sit still for very long. I mean, I can, but I don't want to. I just want to get back to where I was before I went in the hospital. Just getting healthy. I want to get healthy again. I look forward to talking with you because that way I get to tell you, I'm kind of proud of my progress as well. And it's nice to share it with you because I know you and I are going through this together. You've been right beside me for a year now, and hopefully it could be another year.
We see patients really frequently. I see some of my patients twice, 3 times a week. It depends on what the needs are at the moment. At minimum, I'm seeing my patients on a weekly basis. The care frequency that we do just allows for continued momentum with the patient's care and accountability. I mean, if you have a patient who maybe was just newly diagnosed with diabetes, they were maybe started a medication, still don't really understand everything. It's just a lot of information in one visit to receive. And then the next follow-up isn't until 3 months. There's a chance that the patient won't continue that medicine. They don't understand the rationale. So there's that piece of accountability and keeping them motivated and keeping them informed and part of that plan. We're able to meet them where they're at and really provide individualized care. I have many stories like Russ's, and I hear it on a weekly basis with my colleagues. They all have the same kind of stories. And it's not just the patients, providers too. It's reignited a passion for healthcare that maybe had been kind of smothered just because of burnout and not being able to see that and be able to make this deep of a connection. The relationships you build with the patients, you cry alongside when they're having a bad time, but then you celebrate those wins together too. It's really impactful for both the patients and the providers equally.
I told myself years and years ago, it's like if you can make somebody smile or laugh during the day, you've done your job, so that's what I do. Yeah, it's just so fun talking to you. You make my day. You really do.
It's just been really inspirational to see how someone can come to you just broken and scared and just willing to be there and never missed an appointment. And even when he was in so much pain, which was very evident at times, and he was scared and overwhelmed, he was always positive and smiling and joking and being Russ. And just to see how much somebody can just take charge of their life and make a big difference, and now he's just loving life.